Ann Pereira, University of Minnesota Medical School. I'm aware that Michelle was talking about how there are many clinicians in the room. There are many educators in the room as well. And I think this room is going to be responsible for creating the providers of the future. I'd be curious to hear from the panel, where are the biggest deltas? What are we delivering to you as compared to what you need in providers for the team of 2020? Knowledge or skills or attitudes that we need to work on?
The attitude is that this day and age, you don't have to own it on your own, and being able to let go and recognize that there are going to be people that can do it better. If you have a pharmacist at your fingertips, they're better at blood pressure and hypothyroid, other than the cardiologist, of course, but
no,
hypothyroidism.
Definitely better than the cardiologist.
Okay. But they're better at those things, and allowing nurses to do things, and being able to let go of strep throat so that you can work at the top of your license, and understanding that. And I also think that professionalism and understanding what professionalism actually, what that means. So that's what and then I think too that the concept of you're not doing things to or for your patients, but you're doing them with your patients. We had a discussion today in our Smart Care clinician meeting that I was leading, and one of the discrepancies we have between our providers and the nurses can't figure out is, should I undress the patient before you come in, or should I let the patient stay dressed and then you leave the room if they need to undress? And we talked about it for about 10 minutes, and finally Dr. Welter says, why don't we just ask the patient what they want?
You know, my answer would be, I think the folks that are coming out of training now are well-trained in technical skills, and they have a fund of knowledge that I can't match, but they don't always communicate well. And I would encourage you to work on the communication skills, written skills, and particularly verbal skills, and especially the ability to communicate with patients.
I would second that. And again, I'm wearing kind of the hat of the patient experience guy. But, you know, I think, and on the one hand, I think some of these interpersonal and humanistic skills, you know, can be taught and need to be taught. I actually also believe that whether our mothers did a better job or our genes are better, there are differences in our native ability to do this. But those things we work on for our whole lives. And if people don't get the message during training that this is an essential part of being a caregiver, and I don't care what kind of caregiver you are, and this is really critical. We can teach people a lot of stuff. We can train people. I think we're pretty good at that, but it's really hard to ground people in what humanistic medicine is like, and when they come to you at the age of 30 or 35. I mean, it's the cat's out of the bag.
I was just going to say this is a perfect segue into our next panel, but if would you want one more comment?
I also think that it's important to teach people to try to withhold their judgments about what a patient is going through, because I think we've probably all experienced the patient. I had one last week that I could see her rushing at the front desk, and then they roomed her, and the nurse came out and said, she is really crabby. And I got in the room, and I was getting really crabby. She was really crabby with me, and I finally said, you know, is there anything I can help you with? What's going on? And it launched into, she was in a big hurry because she's always her boss is very inflexible, and if she's late or this or that or the other thing. So I was able to quickly turn the visit around and say, we'll get your needs met as quickly as we can, and we'll get you out of here. And I think she was really satisfied. So I think taking the time to ask patients, what are you worried about, or what are you concerned about, or you know, instead of taking it personally when they're coming across in a negative way, is something that would be good for all new clinicians, all existing clinicians to realize.